Welcome back everybody, my name is Anton, and in this video I wanted to showcase a demo application that integrates with MeldRx and Health Universe. The point of this is to highlight how easy it is to build a healthcare application that starts storing and working with real data and can then be actually deployed to be accessible on the web by anybody. With that being said, don't forget, if you're enjoying the video, leave a like and subscribe. If you have any questions, make sure to leave them in the comment section. Don't forget to check out the description for all the links. And with that, let's go ahead and get started. So here is a demo application deployed to Health Universe. If you're not familiar with Health Universe, go check it out. It effectively allows you to deploy Python Streamlit applications, which is what this application is. So if I go to my apps, and here's the application that I have deployed, it currently lives in this public repository, which is then also deployed. I'm going to be going over the code a little bit, but before we do that, let me just go ahead and demo the application. So I'm just going to give it a quick refresh. I'm going to go ahead and first sign in into my MeldRx workspace. So if I take a look here, I have a bunch of workspaces. The specific workspace that the application is configured to work with are these Health Universe ones, right? So Smart Health IT Provider, Standalone, and Epic. Okay, so in my standalone workspace, this is not connected to any external EHR. I have gone ahead and uploaded some patients. So once I'm actually signed into it, you're going to see that we're going to be working with these patients. And if I want to add more, I can upload a CCDA bundle or a Fire bundle and import patient data that way. Okay, let's close this off. Let's come back to the application. I'm going to go to MeldRx. I'm going to consent. And this should now retrieve the access token to the workspace. Cool. If I go to the search now, I can execute searches, just printing out the results. So this is pretty much just acting as postman. So we got the two male patients here. If I just quickly change this to female, I'm going to get the one result here. And the one patient that we had here is Francesca. So we should be able to get her name here. Okay. So just a very simple search here. We're then going to go to observations, and here I am pulling down all of these patients and just presenting the patient information in a little bit more of a presentable or friendly manner, right? Rather than just a blob of JSON. And then you can also, based on which patient you're working with, you can go ahead and fetch the information about that patient or fetch the observations about that patient and just have a look at them. Okay. So super simple. Once you're basically connected to a Fire API, you can query whatever data you want. A lot of the applications on Health Universe are open source, so you can actually go ahead, take a look at the applications, and there are just a bunch of sample applications here which are not connected with any data. So I gone ahead and copied the Plaquenil calculator and creatine clearance calculator. I don't know 100% what these are for, just managed to connect them up with some data and plug in the relevant values into the formula. Okay, so let's look up for Francesca. If we're treating malaria, for these specific times, this patient has been weighing so-and-so, so they need this dosing, and here's the schedule for this dosing, right? So I don't know how real this data is or if this can be used at all. Just the fact that we're connecting to real data, and based on that, we are displaying or making some calculations. Okay, we're going to do the same with creatine clearance. Let's take a look at Galen. Change the value here. It's age 9, male, weight 28, and we're able to work with this dynamic data. Cool. So let's go ahead back to connect over here. I'm just going to refresh here just how Streamlit works. As long as you don't refresh the page, your sign-in session is maintained. If you refresh the page, your sign-in session is lost. So that is how I just refreshed the sign-in session. Okay. Now I'm going to go ahead and connect with Smart Health IT. They already provide sample credentials for you here. I'm going to go ahead and log in, approve. Again, accept the consent from MeldRx. And I should have the access token. So all of the calls, again, are going to go through MeldRx. You don't have to worry about configuring any other URLs, just pointing to a different workspace identifier. And here you can see there are a total of 337 patients that we can work with, okay? So when I'm looking at these observations, there's going to be a bunch of more results here, right? So Ruthie Williams, I think some of these might have, some of them might not have observations. So I'm choosing to print out the JSON if they don't have anything in here. So that's just what you're going to see, okay? And then, yeah, let's take a look at the Plaquenil calculator. So we're going to take a look at one of the patients. Again, malaria, here are their weights, timestamps, etc. Rheumatoid arthritis, again, just same thing, however, just a different way to obtain your data, okay? And let's go again. Now we're going to do it with Epic. And by the way, if you haven't noticed, we are connecting as a provider to these applications. So this is a provider application. But anyway, let's go ahead and sign into Epic. I'm going to go ahead and choose the FHIR2 login, sample login that they have for their sandbox. I'm going to press login, grant access, consent on MeldRx that we are going to deal out the token. And here's the token. The one main difference with Epic is that they actually require more information for searching. At the moment, there is no solution out there that kind of allows you to vary your UI or inform you about what's required and what's not. It's purely trial and error. And here at Darena Solutions, we're currently working on solving this problem where we can give you some kind of information on what is actually required between all of these different external FHIR API providers, okay? But anyway, we're still making requests to a MeldRx workspace, and we're getting this one patient that we got here, okay? So I'm just going to copy the birthday date here because we cannot just query for all patients in their sandbox. We have to query for a specific one. So Derek Lynn is the one that we're going to be looking for. So here now you can see in the observations, I am giving a search rather than just retrieving all of the observations for all the patients. Let's find observations, and here we have Derek Lynn. So looks like something is wrong with the application. We're losing our state. Let's see how easy it is to actually fix this error and redeploy the application. I'm going to go pop over to PyCharm over here where I have the application. And by the way, the source code is available. I have a .env file with all of my environment variables, and I'm loading them up using .env, and I'm just not going to commit these, okay? So in my main application, the problem is with observations. Now, for most of the stuff, you have to be familiar with Streamlit to understand most of it. I'm going to try to make it as simple as possible for what the problem is and what we need to fix it. So the issue is really simple because once we load the website, we are effectively put into a session. Inside of that session is where anytime you press a button on a website, it will rerun the whole script. So if you want to preserve some data and not rerun parts of the script, you kind of have to preserve them in a session. So somewhere we are wiping the session, we no longer have the patient results to then further down the line try to open the observations or try to open the patient information. Okay, so here's the little error that happened here. I have been saving entries into the session state patient results. And over here, after I have gone ahead and pressed the find observations button, I have saved the results into the patient result variable, and I'm not actually updating the session state. So let's go ahead and see how to run this application locally. I'm going to open the terminal and I'm going to use a Streamlit, run main py. The application is going to start, and here we are. Okay, so I'm not signed in yet here. However, I can still use the same sign-in session as I have on MeldRx. Okay, so what do we need to change? We need to change the entries that we're populating in the session. Okay, so let's take the session state object. We're going to scroll down here, and this condition will trigger if there are no entries. After it, what I'm going to do is I'm going to assign a new object with the entries. Okay, just like that. I will also want to assign this to patient results actually, and potentially just take the patient results and assign them here. And since when we are reloading the page, all we're doing is we're extracting the patient result and assigning it here. So we are just going to store the patient result that we have received and store it in the session. Okay. With this, let's go ahead and see how this works. We're going to come back over here. Just going to refresh the page real quick. Go to Epic, allow the consent screen. And here we have the token. So now if we go to observations and we do the same. So Derek, Lynn, we quickly grab the birthday. And let me actually make this a little bit bigger. Supply here, find the observations, so same result, and now let's see if we can open it. Cool, because the state is now being preserved, okay? And we can also have a look at the observations. So this state that I'm saving here, I'm actually then also reusing it for the Plaquenil calculator, and you can see here we're loading all of these observations automatically. So if I quickly pop over back to the code, I'm gonna go to Plaquenil calculator, and drop down the terminal, you will see that I actually have the same bug over here. So what I'm going to do is I'm going to take this code here, go to the Plaquenil calculator, put this here, and I have the same bug in the creatine clearance calculator. So this is just the way that this was implemented. If you find the patient in one of these pages, that patient result will be reusable between all of these apps, okay? So coming back to here, let's go ahead and search for Derek Lynn again with the birthday. Let me copy it, put it over here, find patient result, and just double check that it works. You can see the application was running there. There we have Derek Lynn, and we can check rheumatoid arthritis, and there we have it. Okay. So we have gone ahead and made our changes. What I'm going to do is bring up a change menu. I'm going to not commit the changes I've done in main. I'm just going to commit the bug fixes that I've done in these files. So fix patient result bug. I'm going to go ahead, commit. And I'm actually going to push it as well. So once the changes have been pushed, they will be appearing in the repository. So you can see that the changes have appeared now. If I go back to Health Universe, my applications, this should be ready to redeploy. So I'm going to go over here, settings, and redeploy. And now you can see here the build has started. So we're going to wait a minute for that to finish and then take a look at our application again. And there we have it. So the app has been redeployed. We're going to go back to the live application, back to connect, and what I'm going to do is I'm actually just going to go ahead and refresh the application. It looks like it is going to need a minute to show up here. Not even a minute, actually, just 1 second. So the application has gone ahead and restarted. So I'm going to go and sign in into Epic again. We cache or preserve the sign-in session on MeldRx, so I don't actually have to go to the Epic sign-in screen again. Just allow that I consent to this app having permissions to access data. And I'm going to go into observations again, just copy the birthday date from here. So birthday date, Derek Lynn, find observations. Here we have Derek, and now the application is working with the bug fixed. Okay, so you can see how I could very simply be using the application in production, find the bug, go to the code, load it up using the same authentication session against live MeldRx, and fix the bug, test it locally, push it, and have the fix ready out there, no problems, right? Let's go to the Plaquenil calculator. Here we have Derek Lynn, malaria, and you can see it automatically loads the observations. And same with the creatine clearance. Let's turn this up to 600, and the result is updated. And this is pretty much it. All that I wanted to show you, a sample Streamlit application written in Python using the MeldRx backend to connect to multiple workspaces, get data from your standalone workspace, or fetching it from a Smart Health IT Fire API or a Epic Fire API. And once the application is ready to be deployed on the web, just go ahead and upload it to Health Universe. And it's ready to be used by, well, users anywhere. Hopefully you've enjoyed this video. If you did, don't forget to leave a like and subscribe. If you have any questions, please leave them in the comment section. Don't forget to check out the description, and have a good day.